What happens when a leading spine surgeon becomes the patient? Dr. Scott Adelman, after a 3-level lumbar disc replacement, he returned to skiing, completed a triathlon, and reclaimed a life without pain. An inspiring story of innovation, resilience, and the life-changing impact of motion-preserving spine surgery.
Okay, I'm here in Park City, Utah today with Dr. Scott Adelman. He's a colleague of mine, and he's also a lumbar disc replacement patient of mine.
Well, thanks for actually taking the time, and I'm really honored to actually sit down and talk to you about what we both kind of do in the spine world. It's really an honor to talk to you about what you're up to because it fits into my practice, and it really is a remarkable pivot shift in my continuum of care.
Sort of having the tables turned on you. You went from being doctor and surgeon and interventionalist, treating patients, to being a patient yourself.
My real true story begins when I was actually in medical school. I hurt my back and I herniated a disc. It wasn't requiring urgent emergent care, but I was recommended to have a surgery. My pain subsided, but that was the beginning of my spine journey and spine pain management. A great continuum of care that preserved motion, preserved options, which is most important now, and the arthroplasty world that you're perfecting has become a top priority for me and how I advise patients today.
What sort of symptoms were you experiencing, leading up to the surgery?
I was always athletic in sports my whole life. I did a lot of high-end ski racing, some triathlons, things that really put some stress on my spine. But as I got into my 5th and 6th decades, I couldn't do the things I wanted to do. I really had endured a long journey of back pain, intermittent nerve pain even, got over those. It set me up for, this is the time. And the right time, the right surgeon, he clearly presented himself in you. And that's how I ended up choosing arthroplasty and disc replacement.
How was the surgery itself? It was a pretty big incision to replace 3 levels.
I had a few days of post-op pain. I took it easy, gave myself the days to relax. By day 5, I was already up and about walking. By day 7, I walked into your clinic from the car and you kind of looked at me like, what's up? You look too good.
I recall getting a picture of you snow skiing about 2 months after surgery, 3 months after surgery.
At 4 months, I was doing well enough that I decided to go out and get a little wind in my face and test it. I was feeling so good. I started skiing this past winter. I didn't want to scare you with my progression because you give me very good recommendations. I was out skiing and enjoying the winter at 4 months. No problems, no pain. It was effortless, and I was so happy about that I had to send you a picture.
Even more amazingly, I received that picture from you last week when you completed a triathlon. You're my first patient who's ever completed a triathlon after a 3-level lumbar disc replacement. And did you have any pain during that race?
No, and my history is I used to do triathlons as a younger adult. I was pretty competitive, but my daughter actually motivated me, my oldest of 2 daughters. She's a very good athlete. And she said, Dad, I'm gonna do a triathlon. Would you do it with me? And I said, of course I will. We weren't thinking about that when I signed up a year ago that I was gonna have a 3-level arthroplasty. But I was doing so well that I decided, no brainer, I'm gonna do a triathlon with my daughter. So at 8 months, just a few weeks ago, my daughter and I completed a triathlon together, and I sent you that picture.
With both the skiing and the triathlon, you told me about it afterwards, not before.
Well, you give very good advice, and your outcomes are unbelievable with my patients as well. I won't say I pushed the envelope, but I definitely tested your success, and it's a remarkable result.
Like any patient that comes back to me after surgery, I'm really happy to see them live a pain-free life again. Can you attest to that as well?
People here, and I know you'll share, there's a little height restoration, so I got taller. There's some adjustments after the surgery that you'll feel that, and that's expected. You do a great job explaining that as well. But the recovery is so quick, the range of motion improvement is so good that I currently am back to doing sports that I used to do like I'm in my 20s, and I don't take any medications. I function with sports that I've been doing my whole life. I'm guarding the fact that I'm not gonna do the extremes, but I'm participating in everything that's meaningful to me at this age in life. It's been so successful that I have really started to adapt a continuum of care that includes arthroplasty much earlier. And we look hard at preserving anatomy that keeps them in that option much more aggressively. That's been transformative for my practice and me personally. It's really invigorated and inspired my career at this point. And I've been doing this for 30 years.
I'm so happy that you're doing so well.
I'm really inspired by the pivot and the paradigm shift that you are living, providing, and executing to the highest level. I'll be very anxious to see where we go with access, authorization, and applications, and look forward to your leadership and guidance in those areas. Congratulations on a phenomenal progress of your career as well.
Thank you so much.